Hi, I'm Dave Poles.
And I'm Danielle Lewis.
Welcome to our Community Conversations podcast.
In our series of conversations, we will be spotlighting individuals and organizations who are doing fantastic things in Peoria County.
We'll be highlighting who they are, what they do, where you can find them, and even how you can help. Today, we are just very happy to have Becca Mathis with us, the Director of Clinical Services with Central Illinois Friends. And she's agreed to spend some time talking about the wonderful work that Central Illinois Friends does, and perhaps even demystifying a little bit about what the organization is all about, who it reaches, and what your mission is. So thank you again, Becca, for joining us. We're excited, as always, to shed light on these organizations. Can you really quick give us a brief summary of your program and your organization?
Yeah, absolutely. So Central Illinois Friends, we're a nonprofit organization here in Peoria. We like to say we're an LGBTQ plus organization, which means that we have staff that represent the community. We also are affirming to people a part of the LGBTQ plus community, but that's not all that we do. So it's really important to us to represent the community. And we also provide sexual health services. A lot of our care is free. So think STI testing, treatment, prevention, HIV testing and prevention. We have gender affirming hormone therapy, a lot of clinical services that are otherwise difficult to access for some folks in our community. And very recently, we just opened our community center. So Central Illinois Friends, our goal is to be the friends of those who need us most, whether that's helping you navigate complex healthcare systems and getting connected to the care that you need, or creating a space where you feel welcome and safe. We're kind of starting to dip our toe more into the community programs side, but we've long been clinical. So,
well, and thank you so much. I really want to emphasize, Becca, I like the fact that emphasis on the word safe. Obviously, as things are changing, for lack of a better word, having that quote unquote safe harbor, if you will, is really important. And you mentioned, of course, community based. As you move into the core mission of your organization, could you shed a little light? When you say community based, are you meaning just our local city, or is it across the breadth of service, I guess, is what I'm looking at?
Yeah, that is actually a wonderful question. So Peoria is our home base. It's where we're headquartered. That's the location of the LGBTQ plus community center. And we also have a clinic here in downtown Peoria. But the scope of practice, or the reach of Central Illinois Friends, is actually across the larger Central Illinois. So picture all the way east to west through Central Illinois. That's part of our service region. Over 15 counties, honestly, is what we serve, especially with our HIV prevention programs. Okay. So even if someone is living up in LaSalle or down in Champaign, that is technically still our service area. We've got a cute little mobile unit that goes out and about. We've got a lot of folks that are outreach. Based.
So I was just going to say, I was driving down, every time I come off the off ramp of 74, I see a van there. You get to drive the van?
I have driven the van. Yes. I was a little intimidated at first, and you get the hang of it pretty quick.
Yeah. Well, and I think that that logo really, as I drive by it, I kind of smile, but I also feel that, wow, as we shed lights on our community and all the needs, it's just nice to see that as a visible reference that there is some safety and accessibility for everybody. And again, thank you for that. That was a great eye-opening for me, that it's across the breadth of your coverage area too. So that kind of gets into the core mission. What are some challenges to your core mission?
Yeah. So overall, Central Illinois Friends mission is, again, supporting and being the friends of those who need it most. Our roots are in HIV prevention and supporting people living with HIV. So picture our friends who are our most vulnerable communities. You don't have health insurance, you're low income, you're struggling with mental illness, substance use issues, folks that maybe have a lot stacked against them. And then just trying to get connected to something that you need in real time. It might not be something that we do. Maybe we can connect you with supportive services. Absolutely. A big part of our mission is doing that in a way that's non-judgmental. We are here to accept you as you are. We're here to empower you. We're not here to judge you. We want your care to feel very compassionate and, again, safe. That's why we're very out loud and proud about being an LGBTQ plus organization, because unfortunately a lot of that community doesn't always feel safe or feel seen in healthcare spaces. So our mission is to represent that, and also really patient-centric care. So we have kind of a unique approach, being a community or public health organization, that we're able to flex into spaces that sometimes other organizations can't. We have a mobile unit that we can go out into the community and provide testing services where other clinics might have restrictions or barriers. But to that, our barriers, a lot of times the barriers that we face are similar systems to what our patients are trying to navigate. So what I mean by that is, for example, health insurance. I think if you ask anybody that works in health insurance, it's that landscape is a complete nightmare. And though we don't currently bill for our services, we do have some folks that need help navigating those systems. And it can be just as complicated for our team of professionals, oftentimes to face that as it might be for our patient. But the difference is that we try to make the point to say we're here to advocate for you and be that support person. So if you feel like you're completely exhausted, you don't have the time to make those calls, you don't know the language to communicate what it is that you need, then we'll step in and try and do that for you. We'll do that with you. I would also say a pretty significant barrier or a challenge that we face as an organization is that people's needs are ever changing, right? And so that balance of making sure that the work that we're doing is truly staying within our mission as an organization, but not shying away from the challenge to say, but what role should we have in potentially supporting the need of the community? It's a big reason that we opened the community center, in all honesty. If you talk to our executive director, Derek Kimler, he'll tell you that a big reason that this came about was because he kind of looked around and he said, well, why not friends though? You know, we're in HIV prevention, we do STI testing, but why can't we be the organization that opens a community center? Because no one else seems to be capable of doing it or trending that direction. No. And so I'd say sometimes the challenge is facing the challenge in the face and saying, maybe we're not the ones, but could we be the ones?
Yeah.
Right now, our community center is open during our regular operating hours. So typically that's Monday through Friday, about 10 a.m. to 5 p.m. If you're not sure, then just give us a call or you're welcome to stop by, but you're most likely to catch us 10 a.m. to 5 p.m. We are actually in, a lot of folks from Peoria hopefully know exactly what I'm talking about. The really cool looking building that had like the colorful accents on the outside across the street from Journal Star on War Memorial. That is us now, used to be an architecture firm, but our address is 2112 East War Memorial.
You know, as you were talking, Becca, your name's been synonymous with healthcare in a variety of ways over the past years. I know as an educator, I remember that. And I think you've seen, perhaps in the different organizations you've been involved with, challenges and the successes and the expansion of service too. So, you know, from your perspective and historically and present, how does one access your services? How do they get to the resources you have? What's a best practice?
Yeah. Oh, I love that question. I have so much to say about access. It's actually the main reason I took this job. So accessing our services, I'll get straight to the point on that one. So there's no confusion. It could be as easy as a phone call. So if somebody wants to call our clinic, they can give us a ring. If you Google us, you'll be able to find our website or social media. You can message us on Facebook, on Instagram. You can walk into one of our clinics. You can walk into our community center.
Yeah.
Central Illinois Friends, the access is a really big point for us. I think a lot of folks misunderstand access to healthcare as the building's there. It exists. Right. When in actuality, access is a little bit more nuanced than that. Sure, the building is there, but do I have transportation to get to the building? Is it open during the hours that I'm not working? If I'm a young person, is it really visible in a space in my community where I'm afraid that other people are going to see me walking in there?
Again, to emphasize that safe space as you were talking.
Absolutely. Yeah. Then access for friends is we want to be as accessible as possible, even if it's just reaching out and asking a question.
Yeah. That's a great point. I think that those seeing this, hearing this, and viewing this understand that safety is a big part. I want to emphasize that. And again, the accessibility at different hours based on the services provided. And I think that that's really important. So how can we support your organization's efforts? What's a way that we could support? Because I think it's a great cause, a great organization.
Yeah, absolutely. I mean, so many different ways. The one that I'm sure comes to mind for a lot of folks is volunteering.
Yep.
We will be happy to welcome you, whatever your time, your talents, your willingness to invest. We've got some folks that volunteer with us on a regular basis in the office organizing things. Some people come on outreach with us. We've got folks with clinical backgrounds who join us and actually help deliver care in some instances when it's especially difficult maybe when we're going to like a rural community we might not have access to a lot. So volunteers and that people power can really make a difference. But outside of that, honestly, one of the big ways that I encourage people to support organizations like Central Illinois Friends that have a really strong mission and maybe a particular service area is helping us destigmatize the conversation. So even if you're not volunteering for Friends or donating to Friends, but if you can get behind or stand behind the importance of comprehensive sexual health education or inclusive education in classrooms or in community settings, or
Right.
making sure people don't feel shame or guilt for asking questions about their health and wanting to find answers, being an advocate kind of in that space is something that inevitably benefits Central Illinois Friends, but also the point being benefits our community too.
And Becca, you're absolutely right. I think Central Illinois is a wonderful place, and we have so many. We have a reputation, as we're finding with these conversations, as a very giving.
Yes, absolutely.
And I like what you're talking about. All of our organizations supporting them, and you emphasize the destigmatizing. I completely agree. And so, hopefully, our listeners can really respond to that too, because again, as the conversation shifts and changes across our country, we definitely want to make sure that everybody is welcome. And again, Central Illinois is a great place. So your organization does so much for us. So is there something that's really impactful that you look back on that really, truly you've been involved with? And I guess related to that, maybe giving us an example of how you made a difference in the community.
Oh, that's such a great question. I have to pick maybe not a bajillion answers. So when I first joined Central Illinois Friends, like I alluded to already, the point of navigating access to care.
Yeah.
I think that's really what drew me to Central Illinois Friends. And I think it's something that Friends does really, really well, is that the way that we deliver care and our model of problem solving, in all honesty, is different. It's looking at what's going on and having also the capacity and the team members trained to help you navigate those systems. But beyond that, one of the things I'm really proud of personally that Central Illinois Friends does is GYT events. So GYT stands for Get Yourself Tested.
Okay.
It is actually a model from Centers for Disease Control, so CDC, adolescent health. But the whole point of that is saying, go get yourself tested. If you're a young person, you're at an extremely high risk for contracting an STI. And this isn't something that should feel shameful or embarrassing. It's something that should feel empowering. Take control of your own health. Learn what those resources are. Go take care of yourself. Make yourself a priority. It's okay to ask questions. It's okay to seek this type of healthcare. So Central Illinois Friends partners with Holt Center for Healthy Living and dozens of other nonprofit organizations to host this kind of like dual program within Peoria Public Schools high schools. So there's a health fair intervention where we welcome all kinds of nonprofit organizations in to say, look what we have to offer you. We're adolescent friendly. We are accessible. We are here to support you and your family. Here's how you get a hold of us. Here's a face to the name of an organization maybe you've heard of. And on the other side is the clinical side. So we partner with Carle In-School Health Clinics and their wonderful providers to provide free STI testing, sexual health education, contraception education, making sure that students feel like they can walk into a clinic and feel comfortable and empowered to ask questions. The reason I'm so proud of that, amongst other reasons, is that being from Peoria, going through Peoria Public Schools and going to Peoria Public School High School, I see this as such a wonderful opportunity that, again, like you mentioned, Dave, Peoria is so giving. There are so many nonprofit organizations that if we just figure out how to collaborate with each other in events like this, we have a lot more to offer and a lot more to put out there. And I just think of the number of people that I went to school with that really could have benefited from some of the resources that we bring for GYT, not just sexual health services, but mental health services, or even just knowing that there are other careers out there in healthcare besides being a nurse or a doctor, learning what social work is and what public health is and all of these things, right? So that's a program I'm really, really proud of.
You'd think, kids, they ask great questions.
They ask great questions. You just got to give them a chance.
And kids are more inquisitive and helpful to each other and respectful, really, than you'd think. I'm amazed. I think that's so thank you for that that program because
Yeah.
I've seen how successful it is.
But in all honesty, I think that so far, Central Illinois Friends footprint for the Peoria community, the biggest one has got to be this LGBTQ plus community center. It's the very first community center of its kind in our community. And I think that we are opening during a time where it is especially relevant and known why a space like this can be extremely supportive in helping people feel connected to their community, feel like they're not alone. We know that those thoughts and feelings are some pretty significant risk for mental health issues.
Yeah.
So even if you're not looking at this as like a behavioral health intervention, it absolutely is. So I'm really excited and very proud to work for an organization that was able to pull this off in our community. I'm not at all surprised that Peoria is willing to support something like this. And I'm really looking forward to what additional collaborative things we can come up with as a community in this space.
That's a great point. I think anybody listening to this, and Danielle, you and I know that the organization we are connected with, social emotional learning, is really truly
Absolutely.
what we are. And, as I look at educators and communities and service, we are a service organization. Becca, your organization is a service organization. Our community, and not just Central Illinois, but across our nation, is only as strong as the people we serve. And I think that that's important to distinguish that. What is one thing you wish that people don't understand about your organization? What would you tell them?
I think for a long time, folks, when I first started, I would meet a lot of people who had no idea what Friends was.
Yeah.
Which I feel like that's what happens to a lot of nonprofits in Peoria. We're all like this big secret, right?
Yeah.
But I do think that sometimes people misunderstand that, so for a long time, Central Illinois Friends was HIV prevention. Yes, absolutely. And so much more. That it's not just rapid HIV testing, which is still very important, but it's also prevention. Like we have a provider that can prescribe PrEP.
Okay.
We can help you navigate an emergency situation, post-exposure prophylaxis. We can provide STI testing and treatment. We collaborate with other providers in the community to provide psychiatric care, to provide therapy, to provide gynecological care. We have hormone therapy. We have our community center. So I think the demystifying about Central Illinois Friends now is that the Central Illinois Friends that maybe you heard of or thought you knew even 5 years ago, we have so much more to offer now because we're trying to grow with what we're seeing our community needs.
And, I've kind of followed the growth of this and a lot of our organizations, and I'm just amazed at how you do. One of the final things, because you mentioned too, along with the testing, the services, the safe space, along that, there are therapeutic sort of offerings. Is that correct? So are those offered in-house or connection with other agencies? Or if you could just allude a little bit to, I don't know if I want to say the counseling, but perhaps, yes, the counseling, but also therapeutic offerings with your organization and how that works and how that referral process works.
Yeah, absolutely. It's actually one of our newer programs. So grant funded per usual, but we do collaborate with other organizations to do that. So currently we're contracted with Whole Life Solutions. We were contracted with a couple counselors, and we're also open to more counselors contracting within this program because as we anticipated, it's a high demand program. But that one in particular is meant to be free counseling services. So individual counseling as well as group therapy, if that's something that a person is interested, with the kind of special target population being first and foremost somebody who is associated with the LGBTQ plus community. So if you identify in the community, you're the parent or a family member of someone in the community, maybe you have a kid that just came out as non-binary and you're like, I have no idea what that means, but I want to be supportive, but I'm kind of struggling with things. That is also the point of these therapy resources. So in terms of referring people, again, we try to make it as simple as possible. Give us a call, reach out to us on social media. Our team is trained to triage based off of what you're telling us and what it sounds like you need. If we feel like we can't get the full picture, we'll invite you in for an appointment and see what's going on. If we are not a good fit for someone across the board, no matter what service we have, if we are not a good fit, or we think that there might be a place in the community that might be able to serve you better, or you have health insurance. So congratulations, we actually have identified a place that would work really well with your health insurance. We will send you there. We want to be the linkage to care, but we mostly want to be the opportunity for, if you've had closed doors everywhere else, hopefully we can be the open one.
Thank you for all the great work you do, spending time with us today, helping us get the word out.
Yeah, thank you.
And yeah, can't thank you enough. So anything else
Thank
you
you.
want to say or conclude? And
I'm just appreciative to be able to represent Central Illinois Friends in such a space. We're very grateful for the partnership that we have as respective organizations. I know that you've created a space for Central Illinois Friends to also step into the arena that is professional development and capacity building for educators and community folks alike. So I really appreciate the opportunity. Thank you.
no, and thank you, Becca Mathis, Director of Clinical Services with the Central Illinois Friends. Great stuff, great organization, and thank you for spending the time with us today.